Hi, my name's Dr. Jamie Harris and I've been a dentist for over 30 years. And during my 30 years I've learned some things. And one of them is that a lot of people put off dentistry for major dental work and leave it. And the biggest reason that I've found is cost. And what really happens when people do this is that they create problems. Things become more comprehensive, more extensive, and require more expensive treatment to fix it at the end of the day. And I've been a little bit sad about this, and I've decided as I get towards the end of my career that I'm going to do something about it. I've decided I'm going to reduce the high costs for major dental work. And if I can do this, I can make a lot of people happy, and they can have something that's going to go right forward into the future for them. So my philosophy is this: I like to see a lot of patients, make small margins, and make a little bit of money on each. And that's the best way to make profit, because I make a lot of people happy, and when I do this it also creates things, because I sort of tend to like specialising in things that people really can't afford and creating it so that they can afford it with finance plans. But what it really does is enable me to do a lot of things. Because I do a lot of the one things like crowns and bridges and veneers and implants, it enables me to also go back to my suppliers of laboratory and materials and negotiate with them. And I can get much better rates by doing this. And I'm happy to pass those on to my clients, and that's exactly what I do. So did you know that I can actually supply dental care at often prices way below what you might experience elsewhere? For instance, crowns, $890. Often a lot more than that, and you can check with your own dentist. Where it gets really interesting is if you're in a fund, it might only cost you as little as $400 after your fund rebate. Now that's really stunning. In fact, I'm so confident about what I'm doing, if you come to me a genuine written quote which is less than what I would normally have done, I will not only match the written quote that you bring in from another practice, but also beat it by 10%. And no, I don't compromise or take shortcuts. You see, I've been a dentist for over 30 years, and I know all the best techniques and all the best materials to ensure you get the best quality care. So what's the next step? Well, basically it's this. I need to see you for a full examination, to have a look around your mouth, take x-rays if required, and possibly some photos. Then we'll sit down and we'll go through all the different options that are available to you. Once you know what they are, you'll have the costings for all of them. You can have timelines, we can organise finance and all those sort of things. Then you make up your own choice, own mind, what you want to do with your mouth. It's up to you. So when you're ready, ring in. In fact, do it today. Ring 81 20 20 30, and I'll look forward to seeing you soon.